Before the commercial break, I spoke with a California congressman from the hardest hit area in the country in LA, and we discussed the COVID relief bill that the president is working on with Congress as we speak. In this segment, what we thought we'd do is take a look at the virus itself, and let's start with two of the president's top advisors.
Imagine where we're at, Chuck, right now. You and I are sitting on this beach where it's 70 degrees, perfectly blue skies, gentle breeze, but I see that Hurricane 5, Category 5 or higher, 450 miles offshore.
Look, I'm not an alarmist, but this is as scared as I have been since the beginning of the pandemic.
Now, even though they have ominous warnings for the U.S., the charts I'm about to show you could be cause for some optimism, albeit guarded. Let's start with cases. More than 25 million Americans have tested positive, but as you can see from this graphic, the trend, it is pointing downward. We're averaging about 115,000 new cases a day, but that's less than half of what we started with at the beginning of the year. Same deal when it comes to hospitalizations. About 80,000 Americans are in the hospital right now battling the virus, but those numbers, they're falling, and by a pretty tangible number. Fatalities, they're also starting to trend downwards. And again, this is all relative. None of these numbers are good. 1,300 people losing their lives in the past 24 hours. And over the past week, we're still averaging more than 2,500 deaths per day. Now, the pace of the vaccination, it is also picking up. More than 41 million Americans have gotten the shot, with 9 million of them already getting both doses. But the vaccine rollout is still riddled with problems, and many argue, given the challenges we face, is still going at a glacial pace. Editorial board of the New York Times, they wrote a piece that digs into some of the issues. Headline saying, "We know very little about America's vaccine debacle." Quote, "The federal government has essentially lost track of some 20 million vaccine doses that were delivered to the states during the previous administration. Part of the problem seems to be a wildly ineffective vaccine management system. Federal government gave the company Deloitte a $44 million no-bid contract to develop software that all states could use to manage their vaccine rollouts. Resulting product so unreliable that many health departments have all but abandoned it. Also, many states have not required health facilities to report vaccine waste despite being asked to do so by the CDC. If we don't know where the shots have gone, how can we possibly know what portion have been lost, discarded, or even stolen?" I want to bring in my guest, Dr. Cioe-Pena. He's an emergency room physician for Northwell Health System. He's also Systems Director of Global Health, and he's been invaluable to us since the beginning of this pandemic, answering so many of your questions in the audience. Doctor, always good talking to you. So, I know you're a half-full person, but when I hear what Dr. Osterholm and others are warning that, listen, bad times are coming, as bad as they are now, they're going to get even worse. And then I look at those trend lines to say hospitalizations, fatalities, positive cases, they're all going down. Which one is it?
Well, unfortunately, thanks for having me back. And unfortunately, Richard, I think it's both. I think what we have here is we're seeing the natural decline from a peak that happened due to lots of mass gatherings around November and December. And we're coming off of that peak about when we said we were going to. The computer model has been predicted, at least for our area, around the 3rd to 4th week of January, we were going to start to see a slow decline. That's what we're seeing. Unfortunately, that's not a result of getting vaccine into people or any of the other public health measures we've taken. It's just a natural decline in the virus, having people in January not mixed as much as when they came from holidays in November and December. Unfortunately, what we're worried about is with these new variants, with other phenomena, people getting together for Super Bowl, people getting together for Valentine's Day, and going into the spring, we're worried that there may be another natural incline again and another peak. And we haven't kept up pace fast enough to prevent that peak, at least from a public health perspective with the vaccine. So even though we're going as fast as the parameters and constraints have allowed us to go, it's still a huge problem. And I do also share their concern. I think we may have a very difficult spring ahead of us.
Doctor, when we talk about variants, and again, for the layperson like myself, they're really mutation on this virus. Is the bigger problem for you guys that these are more deadly, or is it that they just spread like wildfire even more than COVID-19, that they're far more transmissible?
Yeah, so it's a little bit of both, but the transmissibility is definitely a huge problem. The fact that they're more transmissible means that more people are going to get infected with them, and it's sort of a self-fulfilling prophecy, right? This virus doesn't mutate intentionally. It mutates because it's a bad copy machine. And so when you make a lot of bad copies, because you're in a lot more people, the chances of mutations being advantageous and selected for the virus are just greater because there's a greater number of human hosts that it can be in. So the faster that we kind of tamp down this epidemic with good public health and with vaccination, the less wiggle room that virus is going to have to mutate and figure out ways around it. So we really have to be pretty steadfast right now at the social distancing measures, wearing masks, and vaccinating as many Americans as possible as quickly as possible.
The vaccines, and as you said here, it's so critical to get them out. Are you comfortable that the new administration and the folks, and as I mentioned before, a part of your function is, and Northwell's got a sprawling system, that we're going to see a major uptick as we're promised that in March and April it's going to be a lot more available? Is it just the raw numbers, or is it also the coordination that you feel is going to be a lot easier for my audience to be able to get the vaccine, assuming they're ready, willing, and able to take it?
Yeah, I mean, we need to get the supply up to the level of where, someone, the same way we think about flu vaccine. The reason why this is being so tightly regulated is because there isn't enough supply. We've got lots of people who are ineligible for the vaccine who would like the vaccine right now. And I think the issue is that we need the supply so that we're not turning people away. The turning people away and phasing this in is artificial because the supply is not there. And so I am very optimistic that as the supply gets better, these vaccine wait times to get the shot, the appointment and availability, all of that stuff evaporates because we do have a really good mechanism, both as health systems, as pharmacies. We've done this before. We know how to vaccinate America. We just need to have the supply so that we can do this in the fastest and most efficacious way possible.
I did the briefing today with Governor Cuomo, and I saw the list of the hospitals. Northwell is right near the top in terms of your staff being inoculated, okay? But I know anecdotally there are nurses, for example, who are saying either one of two things. One, we're in a family planning stage. I'm not necessarily comfortable in taking the vaccine, or I'm going to wait a few months to see how everybody who took it did. Have you had a conversation with somebody skeptical that's been offered the vaccine but is choosing to either take a pass or a wait-and-see approach? What do you say to those folks?
I try to listen. I try to understand what their concerns are. I think there are a lot of question marks with this vaccine in terms of things that haven't been studied. It's a new vaccine, and there's a lot of lack of years and years and years of evidence, which is what we're used to with most vaccines that we receive now. But that doesn't mean that there's evidence that there's harm. And overwhelmingly, there's evidence that this vaccine is safe. And though, so even those the studies that were done, were in a specific population and may have excluded a certain population, it doesn't mean that there's evidence that it's unsafe in that population. And one thing I can tell, especially nurses that are working on the front line, is that I can guarantee you that COVID infection is more deleterious to your health long-term than COVID vaccine. And so this is for frontline healthcare workers, this is a no-brainer in my mind. And I've even gone to the point to be facetious and tell people, if you don't want it, I'm willing to give it to my wife, my kids, anyone else that'll take it in my family. They're just not eligible yet. So I would love for people to take this vaccine. There's no compelling argument against it yet that I have heard. There is kind of the lack of long-term safety data, but there's really no vaccine in human history that has had long-term effects that have shown up in months and months and years after the vaccine was given. Most vaccine effects that we see are pretty acutely within the first couple of months after vaccines are given. And so this has all the makings and all the markers of a very, very safe vaccine. And so I don't think there's a reason not to take it. And I try to talk to my colleagues about that.
Every time, and you've been really generous with your time where you've answered questions for the audience, I always take note the next day how many thank yous come in from our audience for what you and all the other folks on the front lines are doing. So again, I reiterate that thank you. And if you want to do them a favor, everybody, please wear a mask and socially distance. Doctor, thank you.
Thank you for having me.
All right, everybody, when we come back, one of the concerns folks like that have been having is Things like the Super Bowl, people not playing it smart. Well, we're going to take a look at the big game. And instead this time, and let's face it wasn't exactly a nail biter, the commercials are getting a lot more attention than maybe even the final score. After the break, I'm going to show you the good, the bad, and yes, the ugly.